So this is the next paper we're going to look at. So I've been looking at some nasal spray papers today, nitric oxide nasal sprays. And this one is titled Evaluating the Efficacy and Safety of a Novel Prophylactic Nasal Spray in the Prevention of COVID, a multi-center, double-blind, placebo-controlled, randomized trial. And then this is the abstract, which is always broken down into a background, methods, results, conclusion, some form of that. The background, we know that COVID's all over the world. The aim of the study was to address and evaluate the efficacy and safety of the test agent as a prophylaxis against COVID infection. Let's just double check what the word prophylaxis means, because I'm not sure that word is being used correctly. Prophylaxis. Action taken to prevent disease, especially by specified means or against specified disease. I must have had that word mixed in my head. Okay. The methods. The study is a multi-center perspective, double-blind, randomized placebo control. So that's good. Means it's going to be a thorough study. The key eligibility criteria include absence of significant comorbidity. So people don't have other comorbidities, no previous COVID infection, and no vaccination. Interesting choices. And then participants were randomized into the active agent nasal spray or the placebo. The nasal spray was administered 3 times daily over a 45-day course, so this is a long study. The primary endpoint was the percentage of subjects who tested positive for IgGs anti-spike immunoglobulin G specific to the spike protein. So they're looking at IgGs, anti-spike protein. So looking at antibodies to the spike protein at day 45. That's weird, they're only testing one time point. Hopefully not, hopefully they're testing more than just the end day. Let's see if I miss any comments. Nope. Cool. So that's what we got so far. The results were between April 16th and July 26th of 2021. So this is going to be during the Delta and Omicron wave. Way back. There's 556 participants. $275 tests and 281 placebo. They're saying that the test agent significantly reduced COVID infection compared to the placebo. 36 cases versus 97 cases. So we'll highlight that in green. That would be a good result. And then fewer clinical symptoms were also seen in the test group versus the control. So 57 versus 112 cases. That would also be green. And then no harmful effects were associated with taking the test agent, so that's also a very good thing. So that means no adverse reactions, or at least no serious adverse reactions. And the conclusion is that the test agent significantly reduces COVID infection in healthcare workers with 62% fewer infections when compared to placebo. It's found to be safe and well tolerated and offers a novel treatment option for prophylaxis against COVID infection. So now we're going to go to the intro, and I'm going to do a quick save because I have to, the way I'm saving it on my desktop, I have to override it to keep it. Alright, so the introduction's usually just going through and telling us some history about COVID, and why they're thinking about doing the study, or why they came to the idea of doing this. So they're talking about rapid advances made in vaccination and in treatment of COVID. However, the virus continues to infect and kill people all over the world, and many low-income countries have difficulty obtaining vaccines or affording the more expensive therapies. And globally, there's a significant issue with vaccine hesitancy. Given the importance globally of the COVID pandemic, multiple approaches to prevent and treat infections need to be found. One approach would be to block viral ingress at the time of infection, significantly lowering viral load and potentially preventing infection, replication, and transmission. So that would be a very big, bold claim. So the recent work around COVID has found focus on providing a deeper understanding of the human modes of transmission of COVID and its mechanism of entry into the host cells. Just talking about spike proteins and the ACE2 receptor, that's old news. Key proteases such as the furin site, TMPRSS2, and like cathepsin L. And they're saying this study reports the development of prophylactic nasal spray that is simple to produce and easily affordable. Is this a new paper? What is it? When is it from? So this paper is not a new paper. This is an older paper, not older, but this is from 2022, July in 2022, and it is from the Journal of Clinical Virology. And this is the third paper I've been reading today on the nasal sprays, because a lot of people were asking me about them. So I'm just going through some of the literature to see what is out there, because a lot of people are putting a lot of faith in these sprays, and I just want to see what if they're effective, if they do what people think they're doing, etc., etc. Yep, no problem. Cool. So this is the claim that it's a great thing. It's going to reduce COVID. It's simple and easy to produce, so these are all great things, so we're going to go through and evaluate it. So let's see. It's just theorizing that it's going to prevent viral entry into the nasal epithelium by creating an acidic environment. They're saying that the test agent is stable when stored for more than 12 months at room temperature and is well tolerated. There's no signs of mucosal membrane irritation. They've shown safety in both mouse and rabbit models with no evidence of toxicity. For their prescribed 3 sprays a day. And the objective of this study is to assess the efficacy and safety of the test agent in preventing COVID, and it's looking at high-risk healthcare workers in India as the test population. And then in the methods, they're starting out with the composition of the test agent. I'm going to do a quick save so I don't lose anything. So it's made of water, polyethylene glycol, poloxamer 188, P188. I use this in research. I did use P188. It has cell-saving effects. It's a pretty cool polymer. We were trying to use it for saving cartilage in ACL injuries, so that's fun. Never thought I'd see that one again. Xylitol, disodium hydroxide, hydrogen phosphate, sodium chloride, hydroxypropyl methylcellulose, ginger oil, eucalyptus oil, basil oil, clove oil, sodium hydroxide carbonate, potassium dihydrogen phosphate. Interesting, this one doesn't have nitric oxide, which is what I thought I searched for the nasal sprays. So this one is a not nitric oxide nasal spray. It looks like the thing that would be doing, let's just double check that I didn't miss any comments. Nope. Let's see, what would be killing the COVID? Probably the chloride no. That one. Benzalkonium chloride, maybe, would be the agent. Hydrate, acetic acid. So this is what's creating the acidic fire environment they're talking about. So that's going to be dropping the pH, making it less. But the COVID can survive a low pH. Like, that's not going to kill it. My guess is this is what's doing the bulk of the work, is the benzalkonium chloride. Maybe they'll tell us. We'll keep reading. Oops. All right, so the trial design, the study was a multi-center prospective double-blind, randomized 1-to-1 placebo-controlled trial, so this is really good. Double-blind just means that the researchers, in addition to the patients, don't know if a individual patient has been given a placebo or the test item, which in this case is the nasal spray. So that's good. That makes the statistics more powerful. And the participants were recruited from 2 Indian hospitals, Tulsi Hospital in Kanpur, and then Atharva Multi-Specialty Hospital. So I guess they're both from the similar region, the Uttar Pradesh. Between April and July, we already know that. During the peak surge of Delta, yep, just like I said. And they studied the healthcare workers due to their high exposure to COVID infections. So it was a safe bet that these people were probably going to get infected with COVID at some point, so that's why they selected it. The inclusion criteria were older than 18, absence of significant comorbidities to prevent the confounding factors, exclusion of pregnancy or lactation, they didn't have any blood treatments or antibody treatments in the last 3 months or during the study period, no history of drug or alcohol abuse. So this is weird. So they're saying previous vaccination against COVID infection, but earlier they said no previous vaccination against COVID infection. So I can't tell if it's... So it looks like they meant earlier having a previous COVID vaccination because they're testing for positive COVID antibodies, which would be produced from the vaccine. Okay. They just wrote it weird earlier, I guess. Okay, so randomizing and masking. So by masking, they mean masking the sprays so that like they both look identical. So people can't tell like, oh, we're both green bottles, so we're both in the same group type of thing. They make it completely identical as opposed to having a green bottle and a blue bottle. Because then people pick up a bias and they're like, oh, that's the control subject, or oh, I think that's the test subject. And then sometimes when scientists are processing data that have an unconscious bias, we all have unconscious biases, and sometimes we can like favor the test data a little bit. which leads to inaccuracies, and that's why double blind is extra thorough. So for this, they did 140 microliters per nostril for 45 days with a gap of 6 to 8 hours between doses, administered 3 times a day. A compliance rate of less than 80% during that 45-day time period was classified as a protocol violation and were excluded from the study. Assessment of symptoms and adverse reactions was at 16, 32, and 45 days. Yep, they only did, they measured on day, they took blood measurements on day 1 and day 45. Wow. That's silly. And then they did hematology and biochemistry blood tests on day 1 and day 60. So I'm guessing they stored the samples for 15 days on average before testing, doing additional testing. Let me just check if I miss any comments. We're good. Cool, so now we're getting through the basis of what the study's doing. Their outcome points, we already know those, but let's just check. An issue during the study was detected with the positivity rate at the lab dropped from 15 to well below 0.5%, which is below the national average for India at that point, which means that not a lot of people in the hospital were getting sick. And then because of that, they switched from they switched from an initial indicator of serum immunoglobulin G specific to the switch to the positive serum immunoglobulin G specific to the protein of SARS-CoV-2 that was substituted as the endpoint. Okay, interesting. The anticipated rate of event was 10% for the test agent group and 50% for the control group. Interesting. They allocated a 10% dropout rate for their samples. So they estimated that they would need 648 participants for the study size. Then they're doing some non-parametric testing analyses, which is interesting to me. Okay. So 648 were enrolled. Well, 650 were enrolled. 2 were excluded due to contracting COVID infection post-screening. So that was before they would have started the sprays. So they excluded those 2. So that dropped it to 648. They split 324 to the nasal spray and 324 to the placebo spray. And 49 were excluded from analysis for some reason or another. In the nasal spray, 43 from the placebo spray, leaving 274 in the nasal spray and 281 in the placebo spray. So that's how those numbers came to be. Cool, now we're in the results. Here Here we go. Meat and potatoes. And then I'll just check, see if there's any comments that people are asking or questions. Nope. Cool. So in this table, on table 2 over here, they've got the breakdown of the total cohort, the breakdown by site. So interesting. So a lot of what? Looks like they lost a lot of patients, but that doesn't make sense. I'm gonna have to keep reading before I talk about that table. So the mean age between groups was statistically significant, but I mean, it was like 3 years, so it's not that bad. So it's 43.3 years in the test group compared to 40.3 in the placebo. So the placebo group was slightly younger on average. The test group was slightly older on average. I don't think that really matters. It's 3 years on average. "556 participants underwent the IgGs testing, so that's for the antibody for the spike protein. So 36 cases where, there we go, that's where the numbers are coming from. So 36 cases had the COVID antibody, which means they had the COVID infection at the endpoint, the 45-day endpoint in the test group, while 97 had it in the placebo group. So the placebo theoretically wouldn't be preventing illness. So it's 13% of the population in the test group versus about 35% getting COVID in the placebo group. And this represents a 62% relative risk reduction in infection rate. And then that's where these numbers are coming from. That's why they didn't make sense, because they're then breaking down the test agent ones that got infected compared to the placebo that got infected. And what was interesting is that there's more patients in the placebo group nope, that's not interesting at all. Never mind. So that's neat. So 3 times more men than women were infected with COVID in the placebo group, and about for men and women, about 3 times more were infected in the placebo group than in the test group, with the highest proportion. No, that's still relative, so relative risk of about 3 times. And I'll just check the comments. Nope, we're Gucci. Okay. They found that age was not found to be associated with the development of COVID antibodies, which negates any potential effects in the differences of age between the two groups. So that's good. Ouch. And there was a statistically significant reduction in experiencing clinical symptoms with those treated with the test agent versus the placebo. 57 versus 112 cases. So that was about 18% had clinical symptoms with the spray, and then 35% had clinical symptoms with the placebo. The mean time to resolution of symptoms was 1.74 days in the test agent. Compared to 1.95 days, but that wasn't statistically significant. So it's not resolving symptoms faster with this spray, but it might be preventing infection itself. So that's interesting. That's the opposite of what we found for the nitric oxide. Acceptability testing showed that patients had positive experiencing using both the test agent and the placebo nose sprays. So there wasn't anything that bugged them about it. So like no nasal discomfort or anything like that. No serious adverse events occurred and no subjects died. So in Appendix 1, there's information on this. So let's see if we can... Do we not have a link to the appendix? Oh, here we go. Huh. Let's see, no comments. This looks like the same exact paper. Oh, it's probably the supplemental over here. Supplemental appendix. Will this go to market? Who would be prescribed this? This appears to be an over-the-counter prescription. I'll have to read the discussion, and let me double-check what phase clinical trial we're at here. That's not... And let me double-check what phase clinical trial we're at here. That's not the PDF. So let's see. Huh, weird. They usually list the phase in the bottom discussion. Let's check the top. Well, it's not telling me what phase the clinical trial is in, but what we can do is look for the test agent name. So the test agent was developed by Raphael Labs Ltd. I don't know what that stands for. In collaboration with W Research Foundation. So we can take that. Copy it into Google. And type nasal spray. And then we can go to the lab. So this is a lab led by Professor Steve Davies, Wayne Fleet, Professor Emeritus at Oxford University. So it doesn't look like it's on market yet. But let's check a few more things before we make it. This is a funny website. A rare opportunity to observe scientific breakthroughs. And then you have to click enter to enter the website. Let me just double check in this PDF. If there's any other link. Let's try Fox Bio, the other part of this manufacturing team. So now it looks like this is some startup company. So I don't think their stuff is going to be available anytime soon, but let's... Yeah. It doesn't look like it's actually like been FDA approved or has gone through a process like that. So it probably isn't going to be available, but based off of the ingredients listed, we can sort of guess at what types of things in a nasal spray would be beneficial. So, like for example, we have sterile water. That's just sterile water. That's an ingredient that's not going to kill COVID. Polyethylene glycol 400. That's just a stabilizing medium. Paloxamer 188 is that cool thing that heals cells. Xylitol, it's a gum-based thing. Disodium hydrogen phosphate, that is a salt, I believe. Sodium chloride, another salt. Hydroxypropyl methylcellulose, that's a binding agent. And then these are just for like smells and taste, I'm sure. Ginger oil, eucalyptus oil, basil oil, clove oil, those aren't going to do anything. Then you have sodium hydrogen carbonate. Again, that's just something to balance the pH. Potassium dihydrogen phosphate. That's not going to do anything. This will lower the pH of the area, and that's what they're saying up there is theorized as one of the reaction things. So I think this is probably one of the things that would be beneficial in nasal sprays. Sodium hyaluronic, what? Oh, I'm reading the same line twice. Sodium hyal hyaluronate, hyaluronate. I don't know what the hyaluronate, hyaluronate. I don't know what that is, so I'm gonna Google that. Calcium, no. Chloride dihydrate, no. No, that's not gonna kill it. That's just. Okay, yeah, it's a sodium salt, so that's another salt. So it's likely going to be one of these two agents or the combination of both of them that is going to be what is killing the COVID. So I would probably look for nasal sprays that have these agents within them, these ingredients. Everything else is pretty basic and standard. So for their discussion, test agent has been shown to significantly reduce COVID infections in high-risk healthcare workers, with 62% fewer infections compared to placebo. I mean, I don't like how they said that, but basically it went from 13% or 35% to 13%, so you had a 20% reduction, really. They're really just repeating everything. Sometimes they just like when you read an article, they just kind of like copy and paste stuff from earlier, and it's boring. Because like, tell us new stuff, give us some information, tell us how it fits into the literature. So these are the types of sprays that are currently being clinically trialed in humans. So that's a nice tidbit of information. So earlier today I was looking at the nitric oxide ones. Those don't seem to prevent COVID, but can actually help reduce symptoms and help clear COVID faster. So that's pretty neat. About 4 days on average for the nitric oxide. And then there's these quinine and povidone iodine. Haven't looked at those. That's a nice note. That was nice of them to acknowledge that they didn't test people that were asymptomatic. They only tested people that had a symptomatic presentation. Kind of appreciate when people are deeper thinkers. And see if I missed any comments or questions. And then I guess to fully address the will it go to market, maybe. The clinical data is really good. It just, they'll have to see if their patents cover this, if they have any competing patents they have to work against. They have to make sure that the product is safe in terms of packaging, in terms of, they showed good clinical data, so the next things are like packaging. Is it efficacious in terms of the quality of the spray? Are there any injuries that could occur from like the like during ship testing? Is the bottle going to be damaged, and then could that cause you to like poke your nose or something, like stuff like that. So it looks like they're saying that our study is a good pilot study, but we need a larger study to validate our initial conclusions. So I think that's probably what's gating it. So this is probably a phase 1 clinical trial, and you have to do phase 2 and phase 3 clinical trials. So it looks like they're going to be expanding to a larger population to validate their initial findings here and to strengthen these initial results. So that's probably where they're at currently. Then the conclusions. And then overall, it looks like the user experience is good. So this is a chart of the test agent and the placebo. So not good and bad is over here. So about, I don't know, we'll say 10%, 5%, between 5 and 10% of the people didn't have a good experience. Okay, that's that paper. Cool, so let's briefly go over everything we learned in the paper. So in this paper, they looked at a novel nasal spray that doesn't have a name yet. They they looked at a large patient pool of 600 patients, chopped that down to 200, 400, about 550 patients, due to people getting COVID early on before the trial started and due to other reasons that they did not clearly explain. This was an early study during the Delta wave back in 2021, so a few years back. People had to be 18 years or older, no prior COVID infection, they had to be vaccinated, they couldn't receive blood within the past month, or have detectable COVID antibodies from, or also receive plasma within the past 3 months. They couldn't be pregnant or be lactating. The nasal spray was administered 3 times a day, 140 microliters per nostril for 45 days, with a gap of 6 to 8 hours between doses. Where they really just looked at a final endpoint, 45 days. And they found a significant reduction in symptoms and a significant reduction in COVID antibodies, suggesting that this compound is effective at preventing COVID in certain cases, certain amounts, because people still got COVID. About 13% of the cohort that were on the test agent still got COVID, but that was about a 20% reduction in people. So that is fantastic reduction. And it's possible that the ingredients, ethylene, diamine, tetraacetic acid, and benzalkonium chloride were the specific ingredients that prevented this, and also maybe zinc chloride. Zinc is very good at antibacterial stuff, but I'm not sure if it would be good against viruses. And then, so those are the findings, and then there wasn't a difference in resolution of symptoms, so it looks like this is more towards preventing infection. It helps to reduce the occurrence of infection, but it didn't do anything once you got infected. and this is probably a phase 1 clinical trial, so they need to do more research. This is a startup company that is producing this, so it might not even ever get to market, depending on lots of factors. But overall, it's something interesting and something that is good and gives us some inclinations of ingredients that might be beneficial to preventing COVID. So that was the summary. And cool. I'm gonna log out. Thank you all for stopping by.